بسم الله الرحمن الرحيم. العرض التقديمي دي عن الكودينج سيرتيفيكيشن أو شهادات الترميز الطبي. وفي الحديث بتاعي في الجزء الأول منه بتعرض لما هو هذا الكورس، يعني إيه موضوع الكورس ده. يعني بعدها هيكون في تسجيل آخر عن الاي سي دي اللي هو اختصار ل International Classification of Diseases، اللي هو دي اصدرتها منظمة الصحة العالمية. هنتطرق لتاريخها والتطور بتاعها ومحتوياتها، الاستراكشر بتاع الاي سي دي. بعدها هنتكلم عن بعض المنشورات اللي انشرتها جهات عديدة خاصة بموضوع الترميز وامتحاناته واحتياجاته كده، ودي منشورات مفيدة جدا لأي شخص دايري يبقى اختصاصي في مجال الترميز أو دايري يجلس الامتحانات ويحصل على الشهادات. لازم يعرف المنشورات أو الببليكيشنز دي ويعرف كيف يحصل عليها، ويعني باختصار قيمتها كم. يعني بعدين في سيرتيفيكيشن ايجنسيز اللي هي الوكالات اللي بتمنح شهادات وبتعمل اختبارات وامتحانات بموجبها، بتعطي شهادات، والشهادات دي بتأهل الحاصلين عليها للعمل في مجال الترميز الطبي. وبعدها هندي نبذة بسيطة عن الامتحانات بتاعة شهادات الترميز الطبي دي. نبدأ الأول نتحدث عن الكورس دي عبارة عن exam preparation course. يعني ولو إنه في النهاية برضو أنت بتاخد فيه شهادة إنك حضرت دورة تدريبية في مجال الترميز الطبي. بعض الجهات بتاخد بها، يعني بعض ما ينظر لمحتوى هذه الدورة وكده، فبيمكن الشخص يقبلوه ويشتغل وكل حاجة، ولكن هي الهدف منها إعداد الراغبين في الجلوس لاختبارات شهادات الترميز الطبي. هذا الكورس في الجزء الأول من هذا العرض التقديمي سنتطرق للامتحانات بتاع اللي في النهاية انت بنجهزك لها شنو، والمقررات بتاعتها، وحتى ممكن نلقي بعض الضوء على انه مين مسموح له يجلس لهذه الاختبارات، والفترة الزمنية بتاعت الكورس حقنا والرسوم بتاعت الكورس. الميديكال كودينج سبيشاليست دي الاختصاصي في مجال الترميز الطبي دي هو عضو من ما يعرف بالميديكال ريكوردز بيلينج ديبارتمنت في المؤسسات العلاجيه، ودي يعني جسم مختص بالفواتير يعني والفوتر. يعني ودي الهدف منه، الفواتير عندها هدفين: انه انت داخل المؤسسه العلاجيه انت يتعاملوا معك بموجب فواتير معينه حسب الخدمه اللي تقدمت لك. عشان يطلعوا الفاتوره دي لازم يعملوا ادخال البيانات، والبيانات دي بيدخلوها عن طريق رموز محدده. الدوره دي عن هذه الرموز. الهدف الثاني طبعا هو شركات التامين، على اساس انه الكودينج ده بيساعدها تحدد ما هي الخدمات التي قدمت للمريض، وهل هو بيستحق انه يعني يعوضوه عن الفلوس اللي بيدفعها ويدفعوا بالنيابه عنه ولا لا، وكم بالضبط كده. فاذا وبالتالي الميديكال كودرز ديل بيفسروا الميديكال بروفايدر اند بروسيجر نوتس. النوتس اللي بيعملها البروفايدر واللي بيعملوها ناس البروسيجرز to assess what services were provided to a patient. يعني المريض ده يقدموا له يعطوا خدمات، والمعلومات دي طبعا بيستخدموها to assign a procedure or service code. والinsurance companies now can use it as a basis of coverage. يعني غطوا شنو.
Learn more about medical coding. This video will get you through the what's, whys, and hows of the coding process.
Coders take medical reports from doctors, which may include a patient's condition, the doctor's diagnosis, a prescription, and whatever procedures the doctor or healthcare provider performed on the patient, and turn that into a set of codes, which make up a crucial part of the medical claim. Why we code. Let's start with a simple question about medical coding. Why do we code medical reports? Wouldn't it be enough to list the symptoms, diagnosis, and procedures, send them to an insurance company, and wait to hear which services will be reimbursed? To answer that, we have to look at the massive amount of data that every patient visit entails. If you go to the doctor with a sore throat and present the doctor with symptoms like a fever, sore throat, and enlarged lymph nodes, These will be recorded along with the procedures the doctor performs and the medicine the doctor prescribes. In a straightforward case like this, the doctor will only officially report his diagnosis, but that still means the portion of that report that will be coded contains a diagnosis, a procedure, and a prescription. Take a step back, and this is suddenly a lot of very specific information. And that's just for a relatively simple doctor's visit. What happens when a patient comes into a doctor with a complicated injury or sickness, like an ocular impairment related to their type 2 diabetes? As injuries, conditions, and illnesses get more complex, the amount of data that needs to be conveyed to insurance companies increases significantly. According to the Center for Disease Control, CDC, there were over 1.2 billion patient visits in the past year. That's a stat that includes visits to physician's office, hospital outpatient facilities, and emergency rooms. If there were just 5 pieces of coded information per visit, which is an almost unrealistically low estimate, that'd be 6 billion individual pieces of information that needs to be transferred every year. In a system loaded with data, medical coding allows for the efficient transfer of huge amounts of information. Coding also allows for uniform documentation between medical facilities. The code for streptococcal sore throat is the same in Arkansas as it is in Hawaii. Having uniform data allows for efficient research and analysis, which government and health agencies use to track health trends much more efficiently. If the CDC, for example, wants to analyze the prevalence of viral pneumonia, they can search for the number of recent pneumonia diagnoses by looking for the ICD-9 code 480. Finally, coding allows administrations to look at the prevalence and effectiveness of their treatment in their facility. This is especially important to large medical facilities like hospitals. Like government agencies tracking, say, the incidence of a certain disease, medical facilities can track the efficiency of their practice by analyzing. Now that we understand the importance of this practice, let's take a look at the 3 types of codes that you'll have to become familiar with as a medical coder. 3 types of codes you'll have to know. There are 3 sets of codes you'll use on a daily basis as a medical coder. ICD. The first of these is the International Classification of Diseases, or ICD codes. These are diagnostic codes that create a uniform vocabulary for describing the causes of injury, illness, and death. This code set was established by the World Health Organization in the late 1940s. It's been updated several times in the 60-plus years since its inception. The number following ICD represents which revision of the code is in use. For example, the code that's currently in use in the United States is ICD-9-CM. This means it's the 9th revision of the ICD code. That CM at the end stands for clinical modification. So the technical name for this code is the International Classification of Diseases 9th Revision Clinical Modification. The clinical modification is a set of revisions put in place by the National Center for Health Statistics, which is a division of the Center for Medicare and Medicaid Studies. The clinical modification significantly increases the number of codes for diagnoses. This increased scope gives coders much more flexibility and specificity, which is essential for the profession. To give you an idea of how important the clinical modification is, the ICD-10 code has 14,000 codes. Its clinical modification, ICD-10-CM, contains over 68,000. ICD codes are used to represent a doctor's diagnosis and the patient's condition. In the billing process, these codes are used to determine medical necessity. Coders must make sure the procedure they are billing for makes sense with the diagnosis given. To return to our strep throat example, if a coder listed a strep throat diagnosis as the medical justification for an X-ray, that claim would likely be rejected. ICD-9 codes are updated by the NCHS on a regular basis. One of the biggest issues in coding, and indeed in the health information business at large, is the upcoming switchover from ICD-9-CM to ICD-10-CM. We'll cover this in upcoming courses, but the quick summary is that ICD-9-CM has reached its capacity of use as a coding system. ICD-10-CM provides significantly more codes and thus more flexibility and accuracy in the coding process. The entire medical system is set to change over from ICD-9-CM to ICD-10-CM in October of 2014. Let's turn our attention now to the two types of procedure codes. CPT. Current procedure terminology, or CPT codes, are used to document the majority of the medical procedures performed in a physician's office. This code set is published and maintained by the American Medical Association. These codes are copyrighted by the AMA and are updated annually. CPT codes are 5-digit numeric codes that are divided into 3 categories. The first category is used most often, and it's divided into 6 ranges: evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. The second category of CPT codes corresponds to performance measurement and, in some cases, laboratory or radiology test results. These 5-digit alphanumeric codes are typically added to the end of a Category 1 CPT code with a hyphen. Category 2 codes are optional and may not be used in the place of Category 1 codes. These codes are useful for other physicians and health professionals, and the AMA anticipates that Category 2 codes will reduce the administrative burden on physicians' offices by providing them with more and more accurate information, specifically related to the performance of health professionals in health facilities. The third category of CPT codes corresponds to emerging medical technology. As a coder, you'll spend the vast majority of your time with the first 2 categories, though the first will undoubtedly be more common. CPT codes also have addendums that increase the specificity and accuracy of the code used. Since many medical procedures require a finer level of detail than the basic Category 1 CPT code offers, the AMA has developed a set of CPT modifiers. These are 2-digit numeric and alphanumeric codes that are added to the end of the Category 1 CPT code. CPT modifiers provide important additional information to the procedure code. For instance, there is a CPT modifier that describes which side of the body a procedure is performed on, and there's also a code for a discontinued procedure. HCPCS. Healthcare Common Procedure Coding System, HCPCS, commonly pronounced as HCPCS, are a set of codes based on CPT codes. Developed by the CMS, the same organization that developed CPT, and maintained by the AMA, HCPCS codes primarily correspond to services, procedures, and equipment not covered by CPT codes. This includes durable medical equipment, prosthetics, ambulance rides, and certain drugs and medicines. HCPCS is also the official code set for outpatient hospital care, chemotherapy drugs, Medicaid and Medicare, among other services. Since HCPCS codes are involved in Medicaid and Medicare, it's one of the most important codes a medical coder can use. The HCPCS code set is divided into 2 levels. The first of these levels is identical to the CPT codes that we covered earlier. Level 2 is a set of alphanumeric codes that is divided into 17 sections, each based on an area of specificity, like medical and laboratory or rehabilitative services. Like CPT codes, each HCPCS code should correspond with a diagnostic code that justifies a medical procedure. It's the coder's responsibility to make sure whatever outpatient procedure is detailed in the doctor's report makes sense with the listed diagnosis, typically described via an ICD code. Now that you've got a better idea of what each of these codes is and what they do, let's start exploring each code set in a little more detail.
To continue with the presentation, now I am going to cover the history and structure of the International Classification of Diseases, which is the basis of all coding systems. This classification was introduced by the World Health Organization in 1949, and then it was ICD version 6 or edition 6. And at that time there were 5 versions entitled the International List of Causes of Death, and they changed it to the International Statistical Classification of Diseases. In 1995, the 7th revision of this classification was done in a conference held in Paris under the auspices of the WHO in February 1955. Now, the 8th revision conference was convened by the WHO in Geneva in July 1965, but the 8th revision was modified for use or adapted for use in 1968 for use in the United States of America, and it was entitled ICD-A, version 8. In the beginning of 1968, the ICD-A-8 served as the basis for coding diagnostic data for both official morbidity and mortality statistics in the United States. This was followed by the ICD-9, which was published in 1978, and it is clinical modification published by the Americans, and it is entitled ICD-9-CM, CM short for clinical modification. And in that version, they assigned diagnostic and procedure codes associated with inpatient, outpatient, and physician's office. Work on ICD-10 began in 1983, but the new revision endorsed by the 43rd World Health Assembly in May 1990, and the latest version used by the member states starting in 1994. There was an Australian modification published by the Australians, and they called it the ICD-10-AM, short for Australian modification. Together they published with it an Australian classification of health interventions, short as ACHI, and the Australian coding standards, ACS. So these three documents are used by those working in Australia or systems adopting the Australian approach of coding. Now, the WHO also published ICD-11 recently, which is about 5 times as big as the ICD-10. And this was released in 2018 and officially endorsed on May 25th, 2019. Now, these publications issued by the WHO were used for the production of other publications in the field. So if we start with the WHO publication, which is now currently the ICD-10 and ICD-11, the manuals, and these were used to produce further documents. For example, the American Association of Professional Coders, together with HEMA, they produce a number of documents that coders in US use them. They produce, for example, the ICD-10-CM, the International Classification of Diseases Clinically Modified or Clinical Modification, and the CPT, which is the current procedure terminology, and the ICD-10-PCS, which is the procedural coding system. They also issued something they call the Healthcare Procedural Coding System, the HCPCS, or the HCPCS as they call it, and there were a number of levels for that document. The currently widely used is level 2, and only recently a level 4 version was introduced. The American Medical Association also publishes a number of documents to help coders as guidance for coders. For example, they issue ICD-10 resources, and they also publish CPT code books and CT code sets and healthcare common procedure coding system resources. In Australia, the Health Information Management Association of Australia, the HEMA, also publishes a number of documents I mentioned earlier. The ICD-10-AM, which is the Australian modification, and the ACHI, which is the Australian classification of health interventions, and the ACS, which is the Australian coding standards. All of these documents are used by coders when they are learning, when they are sitting for certification exams, and while they are actually working. So, in short, the ICD-10, International Standards Disease Version 10, issued by the WHO, and there are 2 copies of it. One of them is Volume 1, the tabular list, and Volume 2, the instructional manual. There are Arabic translations of the ICD-10 and ICD-11 mental and behavioral diseases or disorders. These are issued by the WHO, and in that ICD-11 there are a number of chapters covering the various aspects in healthcare. And the products of the AMA, or the American Medical Association, include the CPT, which is the current procedural terminology. Together, they produce different versions every year. The latest is the professional edition, published in 2024, but they also publish together with it Coding with Modifiers, which is a guide to correct CPT and HCPCS Level 2 modifiers usage. There are a number of updates, and an active center, which is the National Center for Health Statistics, is actively producing updates for the ICD-10 CM diagnosis code.
The terminology in medical coding can seem intimidating, but it doesn't have to be. Watch this course and familiarize yourself with some of the everyday vocabulary used in the coding field.
There are a number of important terms you'll want to familiarize yourself with as you learn more about coding. Let's look at some of these now. Category CPT. The CPT code set is divided into 3 categories. Category 1, which is the largest and most commonly used, describes medical procedures, technologies, and services. Category 2 is used for performance management and additional data. Category 3 houses the codes for emerging and experimental medical procedures and services. Category ICD. In ICD, the category is the first 3 characters of the code, which describes the basic manifestation of the injury or sickness. In some cases, the category is all that is needed to accurately describe the condition of the patient, but more often than not, the coder must list a more detailed description of the injury or illness. In ICD-9-CM, categories are 3 numbers, except in the case of E and V codes, which are alphanumeric. In ICD-10-CM, all categories are alphanumeric. Clinical modification. This designation, created by the National Center for Health Statistics, is added to the ICD code sets when they are implemented in the United States. Many countries expand and clarify ICD code sets for their national use. The US, for example, expanded ICD-10 from 14,000 codes to over 68,000 individual codes. This term is abbreviated CM and is added to the end of the ICD code title. For instance, ICD-9-CM can be read International Classification of Diseases 9th Revision Clinical Modification. CMS. The Center for Medicare and Medicaid Services. This federal agency updates and maintains the HCPCS code set and is one of the most important organizations in healthcare today. CPT, Current Procedural Terminology. Published, copyrighted, and maintained by the American Medical Association, CPT is a large set of codes that describe what procedure or service was performed on a patient. This code is divided into 3 categories, with the first category being the most important and widely used. CPT codes are an integral part of the reimbursement process. These codes are 5 characters long and may be numeric or alphanumeric. HCPCS, Healthcare Common Procedure Coding System, pronounced HCPCS. This is the main procedural code set for reporting procedures to Medicare, Medicaid, and a large number of other third-party payers. Maintained by CMS, HCPCS is divided into 2 levels. Level 1 is identical to CPT and is used in the same way. Level 2 describes the equipment, medication, and outpatient services not included in CPT. E-codes. E-codes are a set of ICD-9-CM codes that include codes for external causes of injury, such as auto accidents, poisoning, and homicide. Evaluation and Management, CPT. Evaluation and Management, or E&M, is a section of CPT codes used to describe the assessment of a patient's health and the management of their care. The codes for visits to the doctor's office and trips to the emergency room, for instance, are included in E&M. E&M is found at the front of the CPT manual, despite being out of numerical order. The codes for E&M are 99201 to 99499. ICD. The International Classification of Diseases is a set of medical diagnostic codes established over 100 years ago. Maintained today by the WHO, ICD codes create a universal language for reporting diseases and injury. In the United States, we use ICD-9-CM, while the rest of the world uses some form of ICD-10. The US is slated to upgrade to ICD-10-CM in 2014. ICD codes are numeric or alphanumeric. They have a 3-character category, which describes the injury or disease, which is typically followed by a decimal point and 2 to 4 more characters, depending on the code set, which give more information about the manifestation and/or location of the disease. Modifier. A modifier is a 2-character code that is added to a procedure code to demonstrate an important variation that does not, by itself, change the definition of the procedure. CPT codes have numeric modifiers, while HCPCS codes have alphanumeric modifiers. These are added at the end of a code with a hyphen and may provide information about the procedure itself, that procedure's Medicare eligibility, and a host of other important facets. The CPT modifier -51, for example, notifies the payer that this procedure was one of multiple procedures. The HCPCS modifier, LT, on the other hand, describes a bilateral procedure that was performed only on the left side of the body. Modifier-exempt CPT. Certain codes in CPT cannot have modifiers added to them. This is a fairly short list that can be found in the appendices of the CPT manual. NCHS, the National Center for Health Statistics. The NCHS is a government agency that tracks health information and is responsible for creating and publishing both the clinical modifications to ICD codes and their annual updates. Pathology, the science of the causes and effects of disease. Subcategory. In ICD codes, the subcategory describes the digit that comes after the decimal point. This digit further describes the nature of the illness or injury and gives additional information as to its location or manifestation. Subclassification. The subclassification follows the subcategory in ICD codes. The subclassification further expands on the subcategory and gives additional information about the manifestation, severity, or location of the injury or disease. In ICD-10-CM, there's also a subclassification that describes which encounter this is for the doctor, whether this is a first treatment for the ailment, a follow-up, or the assessment of a condition that is a result of a previous injury or disease. There is one subclassification character in ICD-9-CM. In ICD-10-CM, there may be as many as 3. Technical component. The portion of a medical procedure that concerns only the technical aspect of the procedure, but not the interpretative or professional aspect. A technical component might include the administration of a chest X-ray, but would not include the assessment of that X-ray for disease or abnormality. V-codes. V-codes are a special section of ICD-9-CM that describe patient visits related to circumstances other than disease or injury. This includes live-born infants, people with risk or disease due to family history, people encountering health services for specific or mandated evaluation or aftercare, and a host of other not easily classifiable situations. V-codes have been replaced in ICD-10-CM by Z-codes. WHO, the World Health Organization. This international body, which is an agency of the United Nations, oversees the creation of ICD codes and is one of the most important organizations in international health. Z-codes. Much like V-codes in ICD-9-CM, these codes describe circumstances outside of injury or disease that cause a patient to visit a health professional. This may include a patient visiting a doctor because of family medical history.
طيب بالنسبة للبروسبكتيف كودرز، الناس اللي هيشتغلوا في مجال الكودينج لازم يكونوا عارفين انه الاي سي دي سبيشال اي سي دي 10 ما بالضرورة يكون عندك منه نسخة يعني ورقية او حتى بي دي اف. يعني ليه؟ لانه كل الداتابيزز بتاعت الكودز موجودة اونلاين ومتاحة على اكثر من منصة. يعني فلو بدينا بالسي ام اس اللي هو السنتر فور ميديكير اند ميديكيد سيرفيسز في امريكا، عندهم في الموقع بتاعهم كمية من الريسورسز، مش بس الاي سي دي 10، عدد من الريسورسز. لو مشيت في الموقع بتاعهم هتلقى الاي سي دي 10 سي اس سي ام والاي سي دي 10 بي سي اس، وتلقى لكل واحد منها ريسورسز تابعة له. يعني you can download different types of resources من موقع الاي سي دي بتاع السي ام اس. ده just as an example من السي ام اس. ايضا السي دي سي اللي هو Center for Disease Control and Prevention بتاع امريكا يعني برضو مخلي الكودز اونلاين ف you can go straight to their site and in their site you can find او اول حقيقة عاملين هم منصة خاصة بالاي سي دي 10 سي ام تولز وهنا زي ما ملاحظين it's a searchable database فيها الديزيز اندكس وفيها الاذرز لكن هنا طبعا شايف 000 once you start searching for anything مثلا نقول myocardial infarction when you search their database بيديك قال لك في 167 disease index وديل والكودز بتاعتهم موجودة على طول وعليه you can search the database مباشرة وتحصل على الكود اللي هو ده شايف دي الكودز المختلفة للمايوكارديال انفاركشن وفي chapter 9 اللي هو disease of the circulatory system اللي هي دايما بقع بين 100 و 199 فإذا اونلاين تبع السي دي سي في داتابيز WHO نفسها مخليه الاي سي دي 10 اونلاين برضه كداتابيز و if you go to the icd.who هتلقى طوالي حتى دي الفيرجن بتاع 2019 انت ممكن تمشي طوال disease of the nervous system وتلقى الكودز طوالي موجوده والشابترز المختلفه يعني فاذا برضو ال WHO مخليه الاي سي دي 10 as a searchable database and browsable database موجوده اونلاين. في مواقع كمان متخصصه ما هي موقع تبع WHO ولا CDC ولا CMS ولا اي كده زي ما تقول جروب اوف يعني enthusiasts عملوا برضو موقع وسموه برضو ICD-10 data وهناك انت ممكن تلقى برضو the different codes diagnosis codes coding rules الى اخره فبتلقى كلام كثير عن الكودز والكودز نفسها هذه الكودز نفسها you can copy the codes or you can have a look at the details of the codes and everything طبعا الموقع نفسه فيه حاجات مختلفة DRG وفيه الهيكبيكس وكل شيء إذا ده موقع آخر موجود وفيه داتابيزز خاصة بالاي سي دي 10 وبالتالي لو لاحظتوا CD10 is available online in different platforms in the form of searchable
10CM. ICD-10-CM is a set of codes that is set to replace ICD-9-CM in 2014. This course will teach you ICD-10-CM and will give you a foundation of how to use it in everyday coding.
The changeover from ICD-9-CM to ICD-10-CM. In the United States, we've been using the ICD-9-CM code set since the late 1970s. ICD codes are updated every 10 to 15 years and typically just include expansions to existing code sets. The upgrade from ICD-9 to ICD-10, however, involved a shift in format and organization. Because of the shift in format and the headaches that go along with reformatting every aspect of medical reporting in the industry, the United States was unwilling to upgrade to ICD-10 when it was initially published in 1999. In the years since, the deadline to upgrade to ICD-10 in the US has been pushed back repeatedly. As a result of this, the United States primary code set for representing diagnosis is more than 10 years out of date with the rest of the world. Canada and Australia, for instance, updated to some form of ICD-10 in the early 2000s. The US had originally intended to upgrade to ICD-10 and its attached clinical modification ICD-10-CM in October of 2013, but this was pushed back to October 1st, 2014. This is considered the hard deadline for the upgrade, and coders around the country are hard at work learning the ins and outs of this new, significantly larger code set. This presents a bit of a challenge for incoming medical coders. The ICD-9-CM set is still in use today, and coders must be able to use it quickly and efficiently. But the ICD-10-CM upgrade is looming, and coders must also be able to use that code set effectively. Adding to the complications is the fact that for 2 years after the upgrade, ICD-9-CM codes will still be used in sort of a transitional phase, meaning coders must be able to move between code sets freely. With that challenge laid out, let's take a look at ICD-10-CM and discover more about this new and important element of health informatics. The code itself. As we mentioned, ICD-10-CM code is similar to ICD-9-CM in what it does, but distinct in its format and layout. Where ICD-9-CM is 5 digits and almost entirely numeric, ICD-10-CM is 7 characters and entirely alphanumeric. This is a problem for a number of reasons. For one, the US is no longer speaking the same language as the other countries in the world. One of the benefits of the ICD code system is its universality. While each country that adopts ICD codes tends to tweak it in certain ways, like the United States clinical modification, the roots of the codes are still the same. Not so in the US. Since we're still using a 5-character numeric code set, and the rest of the world is using a 7-character alphanumeric system, it's hard to track. The more pressing need comes from the format of ICD-9-CM itself. To put it simply, ICD-9-CM is out of room. As the field of medicine has grown by leaps and bounds in the years since ICD-9-CM was implemented, the code set has struggled to keep up. There are now too many new diseases, diagnoses, procedures for the code set to keep up. If we remember our mission of always coding to the highest level of specificity, you can see that this is a real problem. As medical practice has developed and diversified, the old ICD-9-CM code set is increasingly incapable of providing the exact right codes. While ICD-9-CM has developed a workaround in the form of not elsewhere classified codes and other unlisted codes, it's not ideal to work with intentionally nonspecific codes. Enter ICD-10-CM. The code set is significantly larger than ICD-9-CM. There are 13,000 ICD-9 codes and 68,000 ICD-10 codes. And its increased number of subcategories and subclassifications, the digits after the decimal point, allow for a far greater level of specificity in coding. ICD-10-CM is also more flexible and was designed in such a way that eases the entrance of codes for new, recently discovered, or expanded diagnoses. Layout and organization. ICD-10-CM is, as we've mentioned, a 7-character alphanumeric code. Each code begins with a letter. That letter is followed by 2 numbers. Like ICD-9-CM, the first 3 characters of ICD-10-CM are the category. The category describes the general type of the injury or disease. The category is followed by a decimal point and the subcategory. This is followed by up to 2 subclassifications, which further explains the cause, manifestation, location, severity, and type of injury or disease. The last character is the extension. The extension describes the type of encounter this is. That is, if this is the first time a healthcare provider has seen the patient for this condition, injury, or disease, it's listed as the initial encounter. Every encounter after the first is listed as a subsequent encounter. Patient visits related to the effects of a previous injury or disease are listed with the term sequela. Here's a simplified look at ICD-10-CM's format. A01, disease. A01.0, disease of the lungs. A01.01, simple. A01.02, complex. A01.020, affecting the trachea. A01.021, affecting the cardiopulmonary system. A01.021A, initial encounter. A01.021D, subsequent encounter. A01.021S, sequela. As you can see from the example, ICD-10-CM branches much farther out than ICD-9-CM. ICD-10-CM allows us to code the location and manifestation of a disease or injury far more accurately, and the extensions reduce the administrative burden by documenting both the diagnosis and whether this injury or illness has been examined before. Still, ICD-10-CM and ICD-9-CM share more similarities than you might think. Like ICD-9-CM, the ICD-10-CM code manual is divided into 3 volumes. Volume 1 is the tabular index, much like that of ICD-9-CM. Volume 2 is, again, the alphabetic index. Volume 3 lists procedure codes that are only used by hospitals. We won't be covering ICD-10-CM Volume 3 codes in these courses. Like the first volume of ICD-9-CM, ICD-10-CM is divided into ranges based on the type of injury or disease they document. ICD-10-CM's division closely follows ICD-9-CM's separation into chapters. For a breakdown of the ICD-10-CM code manual, download our ebook. What's different, as you may imagine, is the levels of detail to which all of these codes can go. ICD-10-CM introduces laterality, which side the injury or infection is on, and substantially increases the amount of information about the diagnosis. Instead of leaving off at closed fracture of distal phalanx of hand, as we would in ICD-9-CM, we can go into fine detail about what type of fracture, on which finger, on which hand, even which visit this is for the particular injury. Conventions. Aside from its format and organization, ICD-10-CM is very similar to ICD-9-CM. It includes all of the conventions you'd find in ICD-9-CM, including brackets, parentheses, includes, excludes. Note that there's a slight variation here. ICD-10-CM includes two types of excludes conventions. Excludes 1. List codes that should never be coded with the code listed above. You can think of this as a hard excludes. Excludes 2. Lists other codes for conditions, injuries that may be part of the condition but are not included here. This is more of a soft excludes. An excludes 2 note functions similarly to a see also note. Code first, use additional code, in disease elsewhere classified, see also, not elsewhere classified, not otherwise specified. Remember, extensions typically provide information on what encounter this is for the healthcare provider with the patient. These are not always included, but in the case that they are, they cannot simply be appended to the end of whatever code is attached. Extensions are only found at the 7th character of an ICD-10-CM code. If a coder has to include an extension for an initial encounter on a code that does not have 6 characters, they must add placeholder characters. Coders use an X for the placeholder digit. If, for example, a coder needs to code an instance of poisoning by unintentional underdosing of antibiotic penicillin, the coder would use T36.0X1A. In this case, the 5th digit is empty, and so we'd use the placeholder character X. Remember that placeholder characters are only used when an extension is necessary. Most ICD-10-CM codes do not include an extension for the encounter. Now that we've got a better idea of what ICD-10-CM looks like and how it's organized, we'll take a brief look at how to use this code in our next course. We'll also cover crosswalking or the transferring of codes from ICD-9-CM to ICD-10-CM.
بعد ما عرفنا تاريخ الاي سي دي 10 الاي سي دي International Classification of Diseases in General واي سي دي 10 على وجه الخصوص، حابين الآن نتعرف على the certification agencies، يعني who is providing certificates and examinations for those certificates. There are a number of bodies and institutions that certify coders. الايجنسيز دي بتشمل اهمها بالنسبه للامريكان يعني approach the American Academy of Professional Coders او in short they call it AAPC، وهذه it's a certification agency وهي برضو الناس they actually subscribe to it and they become يعني members عندها membership. ومعاها برضو الامريكان انفورميشن مانجمنت اسوسيشن، امريكان هيلث انفورميشن مانجمنت اسوسيشن او اهيما. فاهيما is the second body that also provides certification activities or services. عندنا في استراليا في the Health Information Management Association of Australia اللي هي HIMA. فإذا these are the three main يعني certification agencies. لو مرينا عليهم مرة ثانية عشان نضيف لهم an institutions that provides training and certification at a higher level. فعندنا في اليونايتد ستيتس عندنا HIMA اللي هي الامريكان هيلث انفورميشن مانجمنت اسوسيشن، وعندنا AAPC اللي هي الامريكان اكاديمي فور بروفيشنال كودرز، وعندنا في استراليا أهيما اللي هي الهيلث انفورميشن مانجمنت اسوسيشن اوف استراليا. لكن في استراليا there is another institution which is Victoria University and they are offering a coding degree, they are offering a diploma, coding diploma. فإذا these are the main or the major يعني certification agencies. 3 منهم جمعيات وواحدة جامعة. عملية السيرتيفيكيشن نفسها بتبتدي يعني you need to attend some coding program whether an official program offered by the certification agencies مثلا the AAPC, the American Association of Professional Coders. دي it provides training, exams and certification. لكن ممكن الواحد يحضر أي دورة في أي مكان وياخد السيرتيفيكيت لكنها لا يعتبر certified بمعنى certified by a recognized international body. فإذا حضرت دورة تدريبية somewhere you can get the certificate وبعض employers they accept it and they employ you as a coder وكده. لكن if you need to be officially and internationally certified لازم بعد ما تحضر هذا البروجرام بيأهلك لأنه تجلس للاختبارات أو الامتحانات بتاعة السيرتيفيكيشن دي. إذن البروجرامز are designed to aid coders pass certification tests. يعني البروجرامز ما for certification purposes by themselves although they issue certificates ولكن they are designed to aid coders pass certification test. بالمناسبة ما يعني after you pass the test maybe you also need to subscribe to become a member. If you want American coder مثلا لازم تسجل في الجمعية اللي هي American Association of Professional Coders.
What is a CPC exam? There are a number of certifying bodies for the medical coder, but the American Association of Professional Coders, the AAPC, remains the largest and most influential of these. The AAPC's Certified Professional Coder CPC exam is currently the gold standard of coding certifications. Let's take a look at the certification exam now.
The CPC exam is comprised of 150 multiple choice questions. The test takes 5 hours and 40 minutes to complete, making it fairly rigorous. There are 2 breaks in the middle of the test. The CPC exam costs $300 to take, but only $260 if the test taker is a member of the AAPC. The CPC exam thoroughly tests the coder's grasp of the entire coding process, from medical terminology to code sets and beyond. Per the AAPC's website, the CPC exam covers 24 subject areas, including anesthesia, radiology, and medicine. You should recognize a number of these, like evaluation and management or radiology, as sections of the CPT code manual. Others, like anatomy and physiology, are part of the coder's everyday skill set. You should note that the questions on the exam are not divided or identified by the topic they're related to. That is, questions on the CPC exam will test you on all of the above 24 fields of the medical coding, but they won't outright say, this is an anesthesia question. Instead, they'll just ask you about anesthesia or surgery or human anatomy. During the test, you'll be presented with a number of test cases pertaining to the practice of coding. These test case questions will present you with a condensed medical report and ask you to select the correct set of codes from the answers below. For instance, a test case question might read, Sarah, a 45-year-old patient, visits a doctor and presents symptoms including a sore throat, swollen lymph nodes, and a fever. After performing a rapid strep test, the doctor confirms a diagnosis of streptococcal sore throat. The doctor prescribes an amoxicillin as an antibiotic. Which of the following are the correct codes for this diagnosis, procedure, and prescription? There are also general knowledge questions like which type of joints are synovial that don't have an attached test case. That question is related to the musculoskeletal system, but the test won't come right out and say so. You'll have to rely on your knowledge of code sets, medical terminology, best practices, and the coding process in general to pass. Individuals who earn a score of 70% or better will pass the CPC exam. If you fail your first test, you are allowed 1 free retake. Getting certified. Once you pass the CPC exam, you are not officially certified by the AAPC until you fulfill a few other criteria. In order to complete a CPC certification, you must become a member of the AAPC. Certification is also limited to coders with 2 years of professional experience or those willing to complete an apprentice program. As such, the CPC exam is recommended for individuals who have already started their coding career. That won't prevent us from going over the basics of this important exam. You should bear in mind, however, that none of the courses in this section or this ebook will fully prepare you for the exam, nor will the completion of this ebook. Because the AAPC copyrights all the information in the test, along with past tests, the best way to prepare for those exams is to take a course administered by the AAPC itself. You can learn about these preparation courses and buy study books and other materials here. In the next course, we'll give you some basic study strategies for the test.
في الجزء الأخير من العرض التقديمي دي حنتطرق باختصار للcertification exams. We already mentioned them مع certification agencies. ولكن بنتطرق شوية للمسميات بتاعت بعض الcertificates اللي offered by these certification agencies. وهو على كل حال الكورسز والكريدتس they are offered for various coding directives. ديل بيشملوا classes for beginning coders who are just getting into the field. معناها ديل بيحتاجوا ل more material يعني. أو ناس already هم يعني شغالين في المجال ولكن they need to know more فبعملوا لهم continuing education classes اللي هم ديل اصلا coders they wish to receive a hospital credential دايرين يترقوا يعني. وفي continuing education for certified medical coders preparing for code set change. يعني مثلا لما حصل تغيير من كود سيت لكود سيت لازم يعملوا لهم training continuing professional education او CPE. فاذا في مستويات، لكن في جميع الاحوال الكوريكولا كفر ميديكال ريكورد كودينج وكودينج سيستمز زي اللي ذكرناها سابقا، وبتبدا بالميديكال ترمينولوجي اناتومي اند فيزيولوجي لانه without this you will not be able to get يعني the concept. الانترناشونال كلاسيفيكيشن اوف ديزيزز اللي هو الاي سي دي which is the medical coding system standard for healthcare billing and coding system دي بيكون جزء كبير جدا من الكوريكولم يعني غالبا الكوريكولم الاشياء اللي ذكرناها سابقا دي عباره عن complementary content او زي ما في حاله الترمينولوجي والاناتومي والفيزيولوجي حتى والباثولوجي والباثوفيزيولوجي. These are foundational this is foundational content essential for the understanding of the ICD databases or codes. فرغم انه الكورسز بتختلف يعني الكورسز بتختلف depending on the coding expertise of the participants. ولكن the foundation of the curricula generally address the following. They address health data standards. They also address coding and abstraction of data الموضوع بتاع الكودينج نفسه. بتشمل الكواليتي امبروفمنت ميثودز، بتشمل الميديكال ترمينولوجي زي ما ذكرنا سابقا، اناتومي اند فيزيولوجي، الاسبكتس اوف هيلث انفورميشن اللي هو لو لاحظتوا تو من الايجنسيز بتاعين هيلث انفورميشن اسوسيشنز يعني كان هيما او اهيما دي الهيلث انفورميشن مانجمنت اسوسيشن، وبالتالي موضوع الهيلث انفورميشن از فيري امبورتنت. اما الفوكس الكومبريهنسيف فوكس اوف كودينج سبجكت ماتر دي enhances the chances of passing the coding certification examination. يعني التركيز والتغطية الشاملة لموضوع الكودينج هو الأساس رغم إنه these other aspects in the curriculum are important. عادة لما تيجي للكوريكولا الكونتنت بتاعها بيكون مقسم لسكشنز or parts، وغالبا البارتس دي will address the systems. For example, gastrointestinal system. When they address this gastrointestinal system, they usually start with the anatomy and physiology. They start with the terminology used for the gastrointestinal system, and then the pathology and pathophysiology, the clinical features, the diagnostic tests إلى آخره. وبرضه طبعا of course the respiratory system, the cardiovascular system, the gastrointestinal again repeated لأنه ديك هناك الليفر ودي هنا the tract، وبعدين الريبرودكتيف سيستم والميديكال ترمينولوجي as such والفاونديشن بتاعه. These are included in most or all of the curricula ب different level. السيرتيفيكيشن itself بتاع البروفيشنال كودرز عندنا a number of certifications على مستويات مختلفة. There are some which are specific or special for outpatient hospitals, inpatient hospital, the payers for billing and otherwise, risk adjustment. عندنا associate degrees برضو. associate degrees like insurance billing and coding خاصة. وعندنا الميديكال billing and coding دي associate degrees. فإذا these are different types of specializations. بالنسبة للسيرتيفيكيشن لو تذكروا احنا ذكرنا 4 certifiers، 4 main certifiers. عندنا الامريكان اسوسيشن اوف بروفيشنال كودرز دي عندها a number of certificates لكن اشهرهم the certified professional coder او the CPC، وعندهم the CPB اللي هي certified professional biller. دي الاشهرهم لكن عندهم others. عندنا of course the certificates اللي issued by Victoria University is mainly the diploma of clinical coding. عندنا هيما اللي هي الهيلث انفورميشن مانجمنت اسوسيشن اوف استراليا، عندها حاجه اسمها سيرتيفايد كلينيكال كودر، يعني ما بسموها بروفيشنال كودر، بيسموها سيرتيفايد كلينيكال كودر او CCC، وهي دي ديفرنت ليفل، البيجنر والانترميديت، وهم they also number them 1 2 and level 4 levels. وعندنا أهيما برضو offer certificates، وأهيما الأمريكان هيلث انفورميشن مانجمنت اسوسيشن offers certified professional coder نفس اللي offered by AAPC، وcertified coding associate، وcertified coding specialist. إذا لو لاحظتوا there is a diversity of certificates، و depending on what the participant in a program is aiming to become certified on, you will choose the content that is most suitable for you. Reminding you, the main one in America is American Association of Professional Coders، وأشهر certificate they are offering is the CPC اللي هي Certified Professional Coder، وعندهم الإكزام بتاعهم. You can go to the AAPC and register for the exam and get the certifications. أهيما زي ما ذكرنا عندهم CCS، وعندهم اللي هو Certified Professional Tested Skills in Data Quality and Accuracy as well as Mastery of Coding Proficiency. وعندهم الثانية اللي هي CCA، ودي Certified Coding Associate، ودي Self Study Entry Level Coding Certification، دي بيبدأ بها الواحد. والكودينج بروفيشنالز هولدينج دي CCA credential عندهم يعني coding competency in all settings. دي just examples. بالنسبة للبرنامج اللي نحن طالعينه it's not a daily program، يعني في أيام بيكون فيها البيزكس ويبينارز بيكون في المساء، وعندنا بالصباح ماتيريال بتكون online. You can watch an online video, and in another day you need to participate in an online forum or an assignment. Then you will have a coding webinar. بعد كده ده on Thursday. On Friday you will have some coding exercises with coders, and then you will have after that the material covered will be tested in a formative quiz، وبعدين بيكون في discussion webinar عشان يناقش الإجابات اللي موجودة في الفورماتيف كويز. Good luck.